Welcome to the Alzheimer Society of British Columbia's presentation called Accessing Care Services During COVID-19. This webinar was developed for people who are caring for someone living with dementia and were either accessing care services before COVID-19 or are in need of services during these unexpected and unprecedented times. You may be joining us today for a number of reasons, and while every person and every family's situation is different, there are some common challenges we have heard of, and we will discuss strategies to manage the changes that have come. We hope that you learned something today that will help you to manage your situation and that you leave here knowing that you are not alone.
Before we begin, I would like to take this moment to review the Alzheimer Society of BC's role, who we are, and what we can do, in particular about what we'll be speaking about today. We are able to provide support and information to people and families affected by dementia. We are unable to make decisions regarding care services because we are independent from the health authority. We are also not experts on the COVID-19 response. Many of the families we support have been impacted by the changes to the care services being offered and provided by the health authorities during COVID-19. However, because of the unprecedented nature of the pandemic and the uncertain future that it brings, there are many questions that we simply don't know the answer to. For example, we don't know when visits will be allowed in long-term care facilities or what day programs will look like when they are able to open again. But we do know how hard the changes and challenges that have come with COVID-19 have been for many people living with dementia and their families. We know that there are many families who are struggling with not being able to visit someone who is currently living in long-term care. The current visiting restrictions have caused a lot of grief and worry. It is important to recognize that the restrictions are in place to protect the people who live in care homes. And while it is a difficult situation to endure, we want you to know that we have great faith in the compassion and skill of the healthcare providers that we know. This situation is far from ideal, but the system is adapting and doing everything it can to take care of your loved ones through this. If you are struggling with not being able to visit, please reach out to our First Link Dementia Helpline for support through these times. And this number will be shared with you at the end of the presentation. Today, we are going to focus on accessing services in the community and in your home. We will provide information that we have gathered through discussions with healthcare providers, with our First Link clients and staff, and from online information that is provided by the different health authorities. We hope that this information will help you access services if they are needed and help you understand what that might look like so that you can make informed decisions and implement strategies to manage these changes.
Today we will present information that we are hoping will help you to navigate accessing care services during COVID-19, help you to consider the changes to accessing care services that the pandemic has caused, and provide you with strategies for managing the days ahead and accessing services in our new normal. First, we will review the current public healthcare system in terms of how to access care services, and then we will talk about some of the challenges that COVID-19 has presented. We will then provide some information about accessing care services during the pandemic and some tips for managing this, including making informed decisions and how to be more comfortable and help the person living with dementia to be more comfortable in accepting services moving forward. And finally, we will discuss the importance of a caregiver backup plan for those who are primary caregivers for people living with dementia, as well as the importance of self-care in maintaining well-being throughout these challenging times so that you can continue to stay healthy and well. Let's talk about accessing care services through the public healthcare system in British Columbia. Many publicly subsidized care services, such as home support and home care nursing, adult day programs, respite care, and long-term care, are accessed through 5 health authorities across BC. Each health authority has a department called Home and Community Care that is responsible for the operations of these care services available through BC's healthcare system. I need to pause for a moment and let you know that in the Island Health Authority, they have started using new and different language and are now calling the department offering these services home care services. For the purpose of this presentation, we will refer to home and community care, but if you are in the Island Health region, make a note and be aware that this is now called home care services. Regardless of the terms used, they are all required to follow the same legislation and provide the same necessary services to citizens of British Columbia. The process for initiating services from home and community care has remained the same since COVID-19 began. As before, you will have to call to arrange an intake assessment with a case manager. Phone numbers for the office in your area can be found on links to the Health Authority's websites from the Government of BC's website. When you call home and community care, you will probably have to leave a voicemail message and wait for a return call. Try to be politely persistent if necessary, while recognizing that the system is currently not operating as it was developed to do, and that home and community care staff are doing the best they can under the circumstances. We've heard that wait times, assessments, and services offered are varied and changing during COVID-19 through all regions of British Columbia. So who can make this referral? An individual or their representative, a family member or a friend, and your healthcare providers like doctors, nurses, or social workers can all make this referral call to home and community care. Once you connect with home and community care, a case manager will contact you to arrange an assessment to determine care needs and subsidy rate. After the assessment is complete and services implemented, case managers work with families on an ongoing basis to identify changes in care needs and the transition to additional care services when required. There is detailed information about how the system works in the Home and Community Care Policy Manual, which is available on the Government of BC's website. This manual provides detailed information about policies, describes the eligibility for services and access, and explains the process for determining client rates. Let's talk about the role of case managers for a minute. In some health authorities, they are called by different names, but for this purpose, I will call them case managers, as that seems to be the most common term used. The Fraser Health Authority defines case managers as those who coordinate care for people with complex health needs requiring extra ongoing support to live at home independently. Their goal is to help people live at home safely and avoid unnecessary or premature admission to a hospital or care facility. If you already have a case manager or have yet to connect with the health authority, the home and community care case managers are the best people to reach out to if your care needs have changed. If the impact of COVID-19 with the reduction of services that has occurred is negatively impacting the person with dementia's well-being or that of the caregiver, call your case manager or set up an intake assessment. Case managers are the people who coordinate the services. They develop and review care plans and add additional support or care when needed. They will be up to date on the latest changes in system-related responses to the COVID-19 pandemic and what services are available in your community. If you are a caregiver who needs more support at home or is not able to meet all of the care needs of the person living with dementia at this time, call home and community care. They cannot know how challenging things have become if you don't communicate the changes that have occurred and the impact they are having. We have heard from some families that they are waiting longer to talk to their case managers during COVID-19, so be prepared to be politely persistent and do not wait until you need help to call. When talking to a case manager when you first meet them or at a follow-up meeting, it can be tempting to discuss the things that are going well. This is because it can be hard to tell someone that things have become more challenging and to admit that help might be needed. In order to know how to best support you and care for the person living with dementia, the case manager needs to know what has changed. What is too difficult now, what safety concerns have presented themselves, and what the person living with dementia needs to be well. It can help to have a list prepared before meeting with your case manager so that you can guide this difficult conversation and ensure you've told them what they need to know about your circumstances. As I said before, we don't know what the future of these services might look like. We could see changes in case management practices where we see less in-person and more virtual visits, so by computer or telephone. The priority is going to remain meeting the care needs of clients, but we'll need to have be balanced with protecting their health by continuing to remain safely distanced. Because this webinar focuses on accessing care services during COVID-19, we are going to turn now to the challenges that the pandemic has created in terms of accessing care services. But I want to let you know that the Alzheimer Society of B.C. offers a recording of our 1-hour webinar called Accessing Services, where we dive a little deeper into initiating and maintaining a working relationship with case managers and cover some strategies for managing transitions to new services. You can watch the recording of the full Accessing Services webinar on the Alzheimer Society of BC's website. And now I'm going to pass it over to Mariana to talk a little more specifically about accessing care services during COVID-19.
We will now look at how accessing services has changed during COVID-19. We will provide you with some tips for managing during this time that include making informed decisions and helping you and the person living with dementia to become more comfortable in accepting services moving forward. Now, you may wonder why you're seeing an upside-down house on your screen. I'm certain that many of you will agree with me when I say that the COVID-19 pandemic has really turned our lives upside down. Over the past couple of months, we've all become familiar with the importance of hand washing, putting on and taking off a mask, and practicing proper physical distancing. To reduce the transmission of the virus throughout our society, we've had to work together and follow these guidelines, among others. These COVID-19 guidelines have led to changes and to a sense of a new normal. Here are some of the changes that we've heard from families. Many community centers and programs have closed, reducing access to much-needed programs like adult day programs. Many care home visits have been suspended. This may have been determined by the health authority in their initial planning processes for COVID-19, or by families who may have decided to manage care needs themselves and suspend care services until the risk of COVID-19 is reduced. A hard one for many is being kept from their loved ones, either because they are in a space like a hospital setting or a long-term care home that limits visitors to essential visitors only, or simply because your family has decided to keep distance to avoid transmission of the virus. You may have also experienced changes at your local grocery store or pharmacy or laboratory, such as hours changing or new protocols put in place to protect staff and customers or clients. This has led to a sense of a new normal. Over the next while, we should expect to continue following regular hand washing practices and physical distancing to limit the transmission of the virus. We recognize that physical distancing and the use of personal protective equipment, such as gowns, masks, or gloves, in different settings will continue. This has a real impact on people living with dementia, as it can be a very disorienting and confusing time. Our new normal also includes more virtual or on-the-phone meetings. Doctors, specialists, and other healthcare providers are encouraging virtual and over-the-phone visits and limiting in-person to necessary visits. If you need to have a visit in person with the person that you're caring for and you're not sick, contact your healthcare provider to set this up. You may need to provide an explanation as to why an in-person meeting is necessary. For example, perhaps the person living with dementia has communication challenges and using the phone or video can be very challenging. Or perhaps you don't have an access to a computer to do a video meeting. Don't hesitate to inquire about in-person options. The new normal has led to a feeling of an uncertain future for many. Many people are concerned about the effects of canceled services and altered routines on people living with dementia. They wonder how long it will be before the day programs open up, or before respite for caregivers becomes available again. For a person experiencing cognitive changes and missing a familiar routine and faces, or for caregivers who need some help or simply a break, not knowing how long we have to live like this can cause frustration and anxiety. COVID-19 presents all of us with an uncertain future, and that can naturally lead to an increase in anxiety and stress. However, during these uncertain times, family caregivers are encouraged to still reach out to their healthcare providers to inform themselves of the new ways that they're working. In many cases, dropping in or having unscheduled visits won't be accessible, and appointments will be required. It's important for you to engage with your healthcare providers and to continue accessing services wherever possible for the benefit of your health. Now, let's look at the checkboxes on the right side of this slide. Consider these steps when you're inquiring about accessing services for the person living with dementia. Contact your case manager or get in touch with one for the first time to discuss options that are available for the person living with dementia. Plan ahead and expect changes. Knowing that we're living in this new normal, think about what you need to do for your caregiving role and ensure that you stay connected with your circle of support. And finally, focus on things that have changed, things that you need help with. Your case manager cannot know what has changed or how hard things have gotten unless you tell them. Although we can't tell you what they may be able to offer you in terms of care services at this time, they do need to know if you're struggling. The changes that we have just listed have had a real impact on families, people living with dementia, and the staff working at all of these essential service sites. I'd like to share with you some of the stories that we've heard. Families need more time for everything. Getting a hold of people can be difficult as call wait times have increased, and every task requires planning ahead, for example, going grocery shopping or even setting up a phone call with a friend. Reduced supports. This is relevant to both family caregivers and people living with dementia. Due to the many physical distancing guidelines, some personal supports that are more informal, such as some family members, have decreased, as well as other access to regular programs in the community. That in turn increases the need for more formal help and support, which is offered through the healthcare system. And the feeling of uncertainty increases in stressful situations. For example, not being able to stock up on essential supplies when going grocery shopping during that part of the day that you have respite, or having difficult discussions when you're not ready for them, or even just not having a break in the day. This is leading to a lot of burnout for caregivers across British Columbia and Canada. For people living with dementia, change in routine is tied to loss for many people experiencing dementia. Unable to attend a program, unable to meet with family or friends, or seeing staff in personal protective equipment, such as masks or gowns, can be quite disorienting to a person living with dementia. We already know that dementia is an isolating disease, and any disruption in a person's daily routine, including decreased access to stimulating activities or a heightened level of anxiety around them, can result in responsive behaviors, increased feelings of loneliness, and may also cause dementia symptoms to worsen. For workers, and we'll focus on healthcare providers, some of the challenges have been simply the protocols that are put in place to control or prevent infection are important and essential to ensure the health and safety for everyone, but this also makes offering person-centered care challenging. Working during this pandemic has created a heightened sense of uncertainty and stress for workers too, which impacts their own health and well-being. And finally, many staff are experiencing changes in the workplace, which can be difficult to manage. For example, some may be transitioned to new roles to support areas of greater need. For many, the challenges presented by COVID-19 have added to an already challenging situation, especially for caregivers. In the next few slides, we will provide you with some tips to help you manage during this difficult time.
Let's take a moment now to pause and reflect. I have listed some examples of challenges that we've heard from those who have reached out to us. What types of challenges or questions do you have around accessing services during COVID-19? We hope to provide you with some helpful tips so that you can make informed decisions at this time. We encourage you to contact our First Link Dementia Helpline should you have any questions at the end of this session. A final thought before we move on to some strategies. British Columbia is now entering phase 2 of its restart plan, which is its gradual plan to restart the economy. The good news is that we have started to see more services offered, but with enhanced protocols put in place to reduce the transmission of the virus. In terms of accessing health services, you may see more services available than in the past couple months, but the focus will be likely on more virtual or phone options first, then in-person second. So expect a new normal for the foreseeable future. There are limitations on mass gatherings, so it may take time for larger programs like adult day programs to be offered safely again. It's important to keep lines of communication open with your case manager to ensure that you get the support that you need at this time, and stay in touch with the centers to be informed of their changes and what to expect. Making informed decisions and planning ahead is essential at this time. So is staying active and connected. Now, let's get into some practical strategies. At this time, there is a lot of information and stories on the news and online that can create a sense of fear, uncertainty, or stress. I hope you have found a way to spend more time looking at good news stories, which can help provide a sense of hope at this time. Everyone has a different situation and a different set of circumstances. Therefore, it's important to take steps to think about what you need to support the person living with dementia in your life and how you can get that support. Gather as much information as you need to make an informed decision. Consider these 3 steps in making an informed decision. First step, get organized. This is the planning step. Identify the challenge or the need that you're experiencing. Consult with any friends, family members, or other people that are in your circle or network of support, people that you trust. They may be able to offer suggestions or another perspective that you hadn't considered yet. Make a list of everything that you want to ask your case manager or your other healthcare provider, and points that you want to make. It's important to think about what you need help with, and not only just focusing on all the things that you're doing well to support the person. It's okay and necessary to be okay with asking for help at this time. Step 2, prepare for the meeting, whether that's on the phone, in person, or virtually. This is the gathering information step. Consider who you need to speak with about a particular matter. For example, if it's related to home care, getting respite care, or transitioning to a care home, the case manager would be the right person to talk to. But if it's about changes in symptoms or concerns about immediate health needs, speaking to your doctor and specialist would be more appropriate. There are many people working in the healthcare system, and often it can be tricky to navigate. So you are welcome to call our First Link Dementia Helpline. Our staff can assist you with navigating the healthcare system. Before an important meeting or a phone call, take the time to think about your purpose. When the call or meeting is over, what do you want to have accomplished? The last step is keeping records. Record decisions made and who you spoke with. When you get somebody on the phone, make sure you write down their name and their job title. If somebody is going too fast for you to take good notes, politely ask them to slow down or wait. If your phone is set up for audio recording, be sure to tell the person that they are being recorded. In addition to some of these details, some other things that you can think about writing down are when you spoke to a person, so the time and date, what action they said that they would take, or whether or not you need to call them back and when. All of these steps help you make an informed decision and stay in control of the situation as much as you can. Let's consider an example of how to put this into practice. The question is, how do I get additional services if my home support is reduced? Your home support may have been reduced because it was determined by the health authority, or you made the decision to do so to limit contact due to COVID-19. When you're ready to seek out additional support, consider these steps. Get organized. Make a list of the changes that you've seen in the person and what you need. For example, my spouse is unable to bathe or clean himself. He needs help with personal care. The other thing to consider when getting organized, in particular with this example, is make a list of questions about infection prevention control protocol. For some, getting additional services from home care may have caused worry about the spread of COVID-19 from workers to clients. You have the right to ask questions of your home care provider. In the next slide, I will review some of the questions that you can ask your home care provider. So we will come back to this point. The next step is prepare for meeting. Again, that's either over the phone, in person, or virtually. Contact the case manager and be willing to ask for help. Too many people, especially spouses, try to do everything themselves, which is understandable, but this can be overwhelming. Ask for help and be okay to take it. And make sure that you take and give yourself those breaks. If you want services that go beyond what the case manager can offer, consider other options such as private home care or volunteer services. For example, BC 211 has a program called Safe Seniors, Strong Communities, and they can connect you to volunteers who can do things like deliver groceries, provide prescriptions, or do phone or virtual visits. The last step to consider is keeping records. Record the conversations that you have with the case manager, including the dates or other contacts, and follow up if things aren't quite what was discussed or if you need to make more changes. As mentioned in the Getting Organized section of the previous slide, the organization that is delivering your home care have measures in place to ensure that the client and the worker are safe. As a recipient of home care services, you can call the home care provider to discuss your safety concerns and what you can do to work together. Consider the following questions when calling your home care provider. What is your policy on hand washing? When do your staff wear PPE, that is, personal protective equipment, which includes gloves, masks, or gowns? What can you expect? What happens when a worker is sick? Or what type of training do your staff receive on COVID-19? Also remember that you can do your part to keep the home care worker safe. Things like washing your hands regularly and following the guidelines to do so. Also, you can let the home support worker know if you're sick and take the appropriate steps to stay in a separate room while care is being provided. Even if you take all the steps to make an informed decision, you may disagree with the level of care given in any community setting, whether that's at home or even long-term care. This is especially challenging now when you might be unable to visit your loved ones in hospital or community care settings and see firsthand how they're doing. Here are some strategies to consider if you're not comfortable with this decision. I'd like to just mention that some of these steps relate to the steps we just learned about in making an informed decision. Let's start off by making sure that you understand the whole situation. Ask questions and listen carefully to the answers. Get all the details before you take action. Also, know who you need to speak with. If you're not having a successful conversation with one person, perhaps ask to see their colleague or manager or supervisor. You may want to take some time to gather your thoughts before starting the conversation. Jot down some notes and try and focus on the facts as objectively as possible. Humanize the concern. Without getting too emotional, which can really take away from making a point, make sure that the person you are talking to or writing to understands the effects of the situation on the person living with dementia and their family. Avoid arguing, but be persistent. This can be hard to do. Don't get pulled into an argument. Stay polite and respectful even when others don't. And express your appreciation for them and acknowledge that it is a difficult and stressful time for them as well. Showing empathy in these situations can be very powerful.
One of the consequences of COVID-19 is the widespread use of personal protective equipment. We have heard from many families that masks can be disorientating and create communication challenges for people who are living with dementia. As a result, you may see changes in the person, such as increased confusion and responsive behaviors or a refusal of care. Here are some tips to support the person living with dementia to be more receptive to care while personal protective equipment is being worn by their care providers. Wearing a mask obscures a care provider's face, making them harder to recognize, not able to communicate with a smile, and in some cases, they may appear frightening to a person living with dementia. Some healthcare providers have attached a photo of themselves without a mask to their name tag or uniform. Look at the photo on this slide. It is almost impossible to tell she is smiling behind that mask. The mask also covers half of her face, making her hard to recognize. The photo on her name tag allows people to see her whole smiling face, which helps with recognition and in making her clients more comfortable. If necessary, ask the home care provider to speak slower and more clearly, as a mask can muffle their voice, making them more difficult to understand. As a care partner, you could try wearing a mask yourself to help familiarize the person living with dementia to a face mask. And if the person living with dementia appears anxious or fearful in response to the mask, stay with them while they receive care and reassure them that everything is okay. Just make sure that you maintain a good physical distance from the care provider. You may need to help with communication if the person living with dementia has trouble understanding what is being said to them from behind the mask. In a care home setting, it can be difficult right now because of the restrictions on visitors. Acknowledge that the current safety precautions are in place to protect the people in care. Try to accept that there is so much beyond our control right now. This is an incredibly difficult situation for families and friends to be in. Connect with a care home to find ways to stay connected if you can't visit at this time. There's 2 questions you can ask yourself. Number 1 is, what do I need to be okay with the current situation? Do you need updates from staff? Do you need to see the person through a window or on a camera? Do you need to hear their voice on the phone? What will allow you to be okay with this situation right now? And the second question is, what can you do for the person in care? Work with the staff at the care home to determine what you can do to help stay connected. On top of visiting from afar, consider sending emails or letters or photos.
So here's a question to think about. If you or someone else who provides care for the person living with dementia were to get sick, either with COVID-19 or something else, what would you do? As a caregiver in the era of COVID, it's important to have a backup plan in case you or someone else who provides care or support were to become sick. A COVID-19 diagnosis means you will have to self-quarantine for at least 2 weeks. We suggest that you connect with family members and other supports now to identify a backup caregiver. In times of crisis, it's reassuring to know that there is a backup plan. This can lessen the worry about an uncertain future and alleviate stress. Consider these 3 questions. Who? Make sure the designated backup caregiver is fully equipped to take care of the person living with dementia. What? Make sure the backup caregiver knows the following information: the medication information and schedules, list of chronic health conditions, important phone numbers like the doctor, a case manager, or a home care provider, a list of groceries and other supplies in the house, a list of routines, preferences, or lifestyle needs. For example, how does the person get through the day? What's important to them? And finally, where? Make sure your backup caregiver knows where to find everything they will need to take care of the person living with dementia while you are unwell. This includes location of important documents. At the end of this session, you can access a document called Ready Set Plan for Caregiver Absence. This can assist you in creating your caregiver backup plan.
On top of having a caregiver backup plan, it's important that caregivers have plans for self-care. Why is self-care so important? As a caregiver, you give a lot of yourself to someone else on a regular basis. Over time, this prolonged exposure to stress and demand for empathy for the person you're caring for can negatively affect your physical and mental health, potentially leading to burnout. When someone is burnt out, they have reached their limit. It's the body's way of telling you to stop. It will do this by draining you of your ability to keep going about your daily activities. Some signs of burnout include a state of exhaustion or a lack of energy, difficulty concentrating, inability to make decisions, fear of asking for help, becoming socially isolated, sometimes physical pain or discomforts, sleep disturbances, feeling sad, depressed, angry, desperate, wanting to cry, feeling guilty, feeling like a prisoner. There's a lot of symptoms of burnout. One of the biggest impacts of burnout is a decline in motivation and disengagement from daily activities. So, for example, spending time with family and friends or going to appointments. Taking a break from the challenges of caring for somebody living with dementia, even temporarily, can reduce the risk of burnout. As a caregiver, you need to take care of yourself. You are the most important person in the life of a person living with dementia. Self-care is vital and will be even more important during these heightened times of stress. So 5 tips for good self-care. Number 1, try to stay positive. The current situation is temporary. Think about the positive aspects of your life. Remind yourself that as a caregiver, you continue to make a big difference in the person you are supporting. Stick to a routine. Both you and the person living with dementia will benefit from a regular and predictable daily routine right now. Maintain a consistent bedtime and get up at the same time every morning. Eat meals at a consistent time. Schedule physical activity, rest times, social times, and purposeful activities into each day. Stay connected. One of the most challenging aspects of the physical distancing and isolation requirements is a significant decrease in the interactions we have with others. Consider options for staying in touch with friends and family. Regular phone calls or visits over Skype can help you and the person living with dementia to maintain the feeling of being connected to others. Avoid information overload. There is news available about COVID-19 24 hours a day. While it's important to stay informed, too much information can become overwhelming. Limit your news to reputable sources and consider setting time limits or schedule times into your daily routine to get caught up on the news. And get support for yourself. It's important that you get support for your experiences. Identify a trusted family member or friend who can be there for you when you're feeling overwhelmed, frustrated, or tired and need a listening ear. Sometimes just knowing there is someone you can call for support is enough to boost your resilience. Don't forget, you can also call the First Link Dementia Helpline for support. And I encourage you to use some of your time at home to learn about dementia and caregiving strategies. Explore the Alzheimer Society of B.C.'s website for information on topics like communication and behavior, strategies for managing symptoms like responsive behavior, or ideas for activities you can do at home.
The uncertainties that COVID-19 presents can make planning for and making decisions about accessing services difficult. You are not alone. We are here to provide you with information and support. You can call the First Link Dementia Helpline to talk to someone from the Alzheimer Society of B.C. Monday through Friday. The First Link Dementia Helpline in English is available Monday through Friday from 9 a.m. until 8 p.m. by calling 1-800-936-6033. The service is also available in Cantonese and Mandarin from 8 a.m. until 4 p.m. Monday through Friday by calling 1-833-674-5007 or in Punjabi by calling 1-833-674-5003. We also invite you to visit our website to learn more about our upcoming webinars or to access past recorded ones. Visit alzbc.org/webinars. Also, you can find some links to helpful documents related to this session in the More Information section below this video. Thank you for watching this session today. Take care and stay safe.